So many patients come to our office complaining of general shoulder pain.
Best exercises for shoulder pain impingement and bursitis. 70% of chronic shoulder pain is caused by a disease that has many names. You've probably heard of impingement syndrome, subacromial bursitis, and rotator cuff disease. Well, they are basically the same problem. Today, we are going to see what the impingement and bursitis are and what you can do to avoid shoulder pain. But before we go on, like this video and subscribe to our channel.
Things that we're trying to assess your shoulder pain, and we're going to talk purely about impingement.
Bursitis shoulder pain. Inside each of your shoulders is a tiny fluid-filled sac known as a bursa. Bursa help reduce friction between the bones in your joint. If the bursa in your shoulder becomes inflamed, it leads to a condition known as shoulder bursitis. Causes can include injury, overuse, or medical condition that cause joint inflammation, such as rheumatoid arthritis. Shoulder bursitis is also known as subacromial bursitis. It can be treated in a variety of ways, both at home and in a doctor's office.
Tendonitis, bursitis, and what's the last
Capsulitis.
one? Capsulitis.
Right.
What is the lookout for shoulder bursitis? Bursitis is often a chronic condition, which means that overuse will often trigger your symptoms. You may be able to identify the triggers associated with your bursitis, such as working your shoulder muscles too hard. By finding the appropriate activity level, you may be able to reduce the symptoms of bursitis while staying active. However, sometimes only surgery can fully fix the underlying cause associated with bursitis. Surgery. In rare instances, your doctor may recommend surgery for bursitis. Your doctor usually doesn't recommend surgery as a treatment unless you have been experiencing problems with little relief of 6 to 12 months. If you do need surgery, your doctor will most likely do it arthroscopically. This means they will make small incision in your skin and insert surgical instruments to remove damaged areas of tissue that may be pressing on or irritating the bursa. Sometimes the doctor will remove the bursa to create more space for the tendon. Often, physical therapy is recommended for enhancing recovery.
Shoulder bursitis. Now, why talk about shoulder bursitis? Probably because you've been told you've got it.
At home, shoulder bursitis treatment. Because bursitis is often due to inflammation, giving your shoulder enough time to rest can often help reduce symptoms. Example of some of at-home steps that can help reduce bursitis symptoms include: rest the shoulder. Avoid activities that you know tend to worsen symptoms can help to reduce your symptoms. Often, this is an activity in an occupation or a frequent pastime.
The bursa itself is a tissue which is quite similar to a mucus.
Take an over-the-counter pain reliever. Non-steroidal anti-inflammatory drugs are especially helpful in reducing inflammation. These include ibuprofen, Advil, Motrin, naproxen sodium, Aleve. Acetaminophen, Tylenol may also help relieve the pain. Apply an ice pack to the affected area. Always have some kind of protective covering between the eyes and your skin. Wear a cold compress for only 10 to 15 minutes at a time.
So you need to use ice to calm things down a little bit, to calm that inflammatory process down a little bit.
Wear a shoulder brace. A shoulder brace can help serve as a reminder to rest your arm and keep from doing too much. These are available at most drugstores, although you may need a physical therapist or doctor to show you how to correctly wear it. Perform gently stretching activities, but don't stretch to the point of extreme pain or discomfort. Treatment for severe shoulder bursitis.
But it also then, you said, radiates up
Radiates.
here.
It goes
then-
all the way up to my neck, down to my elbow.
Corticosteroids and pain medications. If at-home treatments aren't effective, your doctor may prescribe stronger pain medications. However, this won't heal the underlying causes of bursitis. Another option is corticosteroids injections around the bursa. However, you can only have a limited number of these injections because they increase the likelihood that you could rupture your tendon. Now let's see how to do exercises. Posterior stretching exercise. 1. Hold the elbow of your injured arm with your other hand. 2. Use your hand to pull your injured arm gently up and across your body. You will feel a gentle stress across the back of your injured shoulder. 3. Hold for at least 15 to 30 seconds, then slowly lower your arm. 4. Repeat 2 to 4 times.
So what we're going to do is try to focus on building mobility into the back, break through that rust.
Up the back stretch. Your doctor or physiotherapist may want you to wait to do this stretch until you have regained most of your range of motion and strength. You can do this stretch in different ways. Hold any of these stretches for at least 15 to 30 seconds. Repeat them 2 to 4 times. 1. Light stretch. Put your hand in your back pocket. Let it rest there to stretch your shoulder. 2. Moderate stretch. With your other hand, hold your injured arm, palm outward, behind your back by the wrist. Pull your arm up gently to stretch your shoulder. 3. Advanced stretch. Put a towel over your other shoulder. Put the hand of your injured arm behind your back. Now hold the back end of the towel. With the other hand, hold the front end of the towel in front of your body. Pull gently on the front end of the towel. This will bring your hand farther up your back to stretch your shoulder. Overhead stretch. 1. Standing about an arm's length away. Grasp onto a solid surface. You could use a countertop, a doorknob, or the back of a sturdy chair. 2. With your knees slightly bent, bend forward with your arms straight. Lower your upper body and let your shoulders stretch. 3. As your shoulders are able to stretch farther, you may need to take a step or 2 backward. 4. Hold for at least 15 to 30 seconds. Then stand up and relax. If you had stepped back during your stretch, step forward so you can keep your hands on a solid surface. 5. Repeat 2 to 4 times.
Some of that limitation is coming from his shoulders. It also comes from the upper back.
Shoulder flexion, lying down. To make a wand for this exercise, use a piece of PVC pipe or a broom handle with a broom removed. Make a wand about 30 centimeters wider than your shoulders. 1. Lie on your back, holding a wand with both hands. Your palms should face down as you hold the wand. 2. Keeping your elbows straight. Slowly raise your arms over your head. Raise them until you feel a stretch in your shoulders, upper back, and chest. 3. Hold for 15 to 30 seconds. 4. Repeat 2 to 4 times. Shoulder rotation, lying down. To make a wand for this exercise, use a PVC pipe or a broom handle with a broom removed. Make the wand about 30 centimeters wider than your shoulders. 1. Lie on your back. Hold the wand with both hands with your elbow bent and palms up. 2. Keep your elbows close to your body and move the wand across your body toward the sore arm. 3. Hold for 8 to 12 seconds. 4. Repeat 2 to 4 times. Shoulder blade squeeze. 1. Stand or sit with your arms at your sides. Pull your shoulder back, imagining you are making your shoulder blades touch. Keep your shoulders down as you perform the exercise to feel a greater stretch in front of your shoulders. 2. Hold this position for 6 seconds. 3. Repeat the exercise between 6 and 8 times.
You don't have limitations with extension or internal rotation.
Shoulder blade range of motion. 1. Lift your shoulders up as if you are shrugging them, holding the position for 5 seconds. Lower the shoulders. 2. Move your shoulders downward to feel a stretch across the top of the shoulders. Hold this position for 5 seconds. 3. Rotate the shoulders in a circular motion backward for 5 circles. Stop and repeat by rotating the shoulders forward. Scapular exercise. Wall push-ups. This exercise is the best done with your fingers somewhat turned out rather than straight up and down. 1. Stand facing a wall about 30 to 45 centimeters away. 2. Place your hands on the wall at shoulder height. 3. Slowly bend your elbows and bring your face to the wall. Keep your back and hips straight. 4. Push back to where you started. 5. Repeat 8 to 12 times. 6. When you can do this exercise against a wall comfortably, you can try it against a counter. You can then slowly progress to the end of a couch then to a sturdy chair, and finally to the floor. It is important that you have a proper diagnosis of impingement syndrome by a doctor or a physiotherapist. If your shoulder pain is not getting better, then talk to your doctor or your physiotherapist. They should be able to help you to get individualized exercise that are specific to your problem. If you like this video, don't forget to like it below. You may subscribe to this channel and turn on the notification button so you will be alerted when the new video is uploaded in this channel. Till then, bye!